Alcohol is often socially normalized, but alcohol use disorder is still a serious medical condition. Alcohol has a powerful effect on the brain. One reason alcohol can be so disruptive is that it changes the balance of two major systems in the nervous system: inhibition and excitation. Alcohol increases inhibitory signaling. That's what creates relaxation and sedation. It also suppresses excitatory signaling. That's what slows reaction time, coordination, and memory formation. As blood alcohol levels rise, judgment and impulse control weaken. That's not letting loose. That's reduced executive control. Here's what's happening underneath. The prefrontal cortex becomes less active. That region helps us weigh consequences, pause before acting, interpret social cues, and regulate emotion. As alcohol suppresses prefrontal activity, a person may feel more confident, more reactive, more impulsive, and more willing to take risks. The person might genuinely feel fine, but the brain is objectively less regulated. Now let's talk about blackouts, because blackouts are often misunderstood. A blackout is not the same as passing out. During a blackout, the person is awake. They may speak, walk, interact, even appear functional. But the brain is not recording memory. This happens when alcohol disrupts the hippocampus. The hippocampus is essential for forming new, long-term memories. When alcohol levels rise quickly and heavily, the hippocampus cannot properly encode experiences. Events are lived in real time, but they are not stored. That is why a person may later have gaps. Sometimes partial gaps, sometimes complete gaps. Blackouts are signs of acute neurotoxicity, and they significantly increase risk of injury, assault, and accidental harm. With repeated heavy use, the brain adapts. It tries to restore balance. If alcohol repeatedly increases inhibitory signaling and suppresses excitation, the brain compensates by strengthening the excitatory system. That means tolerance develops. More alcohol is needed for the same effect. And when alcohol is removed, the excitatory system can become overactive. That's withdrawal. Alcohol withdrawal can include tremors, sweating, anxiety, insomnia, and in severe cases, seizures or delirium. This is why alcohol detox may require medical supervision. It can be dangerous to stop abruptly depending on severity and history. Signs of problematic alcohol use may include frequent blackouts, drinking alone, morning drinking, failed attempts to cut down, or withdrawal symptoms. Recovery is possible. With sustained sobriety, many brain and body functions improve. Cognitive clarity often increases, sleep stabilizes, and stress hormones begin to normalize. Advanced organ damage may not fully reverse. That's why early treatment matters. In Part 4, we examined how alcohol affects the brain, the body, and memory systems. We also looked at how repeated exposure can lead to tolerance, dependence, and withdrawal. But addiction does not end with those biological changes. Recovery is possible. In Part 5, we'll explore what happens in the brain during recovery, how families are affected by substance use disorders, and where individuals and loved ones can find support. Understanding the recovery process is essential because healing involves both the brain and the people around it.